Lorna, good morning to you. So there's been a really big rise in the number of people heading to A&E with minor complaints, haven't there?
Yeah, that's right, Marvine. And we heard there from Louisa about those spiffy new ambulances that the Health Secretary's really excited about. But once they get their charges to A&E, it seems those long waits could be exacerbated, not just by the winter flu that we're experiencing at the moment, but also by the number of people turning up with relatively minor symptoms, or certainly that's the case in England, according to the latest figures out from the NHS. And looking at those alongside the numbers for the last 5 years, we really get quite a marked increase in people turning up with what sounds like pretty small-scale problems. So, for example, between 2020 and 2025, staff in A&E had to deal with 1.9 million cases of people seeking help for a headache. And in the same period, around 1.2 million A&E visits were for a sore throat. And then, get this, right at the bottom of the scale, over 4,000 people also went to A&E for hiccups. So pretty startling stats. But it's not as though the stats for everything are changing, because the figures for clear medical emergencies like cardiac arrests are staying constant, about 10,000 in 2020 and around 10,700 this year. But there's a clear increase for those more minor problems like a cough. 44,000 people were complaining of that in 2020, but the number's gone up every year since then to reach almost 436,000 by this year. So that's a near tenfold increase. Well, what is going on? We spoke to one doctor who's worked on the NHS front line in A&E, and he puts it down to the scramble for GP appointments, but also Dr. Google.
A lot of people aren't able to see their GPs or get appointments for some of the more minor symptoms. A part of it is unfortunately the internet and medical anxiety. I think a lot of people will Google their symptoms and realise that there's a slight fraction that this might be something incredibly rare and sinister that they've seen on the internet and panic. And because of that, they want reassurance by coming into the hospital.
Well, NHS providers and GPs want better signposting for people towards other resources like that 111 helpline and pharmacies. And then NHS England itself says it does now have a campaign to point people towards those kinds of community healthcare options. But all of the medics we spoke to, Marvine, just wanted to stress people should still seek help at A&E if they feel they need it.